Hello, my name is Mark Reinhard. Before I begin, let me tell you a little bit about my background. I started out as an electrical engineer working for Boeing in Seattle. While in school at Georgia Tech, I became interested in bioelectric phenomena and especially in the unusual electrical properties of acupuncture points. Eventually, my interest led me to study acupuncture. I graduated from the Northwest Institute of Acupuncture and Oriental Medicine in 1990 and got my national certification and my state licensure. I have had my own practice since 1992. This video is about a new treatment I have developed to treat the memory loss in Alzheimer's disease. After watching a video by Dr. Richard Johnson on the 3 leading causes of Alzheimer's, I realized I could design a treatment that should work very well if he was right. So I came up with one, and I tried it on both acute and chronic patients. And it had an effect in their memory with the very first treatment. So I guess he was at least partially correct. According to Dr. Johnson, the main problem with Alzheimer's disease seems to be with the function of the mitochondria in brain cells. Mitochondria are a part of every cell in your body. Their main job is to convert glucose into ATP, which is the molecule the cells use for energy. The mitochondria are little chemical factories. There are many of them in every cell in your body. They also produce other substances the body needs, which are mainly proteins. In brain cells, they are responsible for the production of brain chemicals such as neurotransmitters and dopamine. So if the function of the mitochondria is disrupted, your brain can't function properly. It can lead to the confusion and memory loss. This usually leads to emotional problems that are common in Alzheimer's patients. One other problem Johnson discovered is there seemed to be some insulin resistance in brain cells that interfered with the glucose absorption in the cells. There was also uric acid stress and acute inflammation on the mitochondria as well. So, what can I do about all this? Well, I have technology that can deal with all of it, directly or indirectly. That technology is called frequency-specific microcurrent, or FSM. Let me discuss the microcurrent part of the name, since it plays one of the most important roles. Microcurrent acts directly on the mitochondria to stimulate ATP production by as much as 500%. That gives the cells, thus exposed to the current, all the energy they need to do whatever job is required. As its name suggests, it uses microamps of current. The current is so low, you generally won't feel it at all, or just barely. And with FSM, I don't use needles at all, so the treatment is painless. Now with FSM, I can do other things as well. There is a protocol, what they call a treatment, for insulin dependence that is used for diabetics that I have modified to treat brain cells instead of adipose or fat cells. In addition, there is a frequency to treat uric acid stress, so I include that in the treatment as well. The frequency-specific part of the name refers to the selection of the frequencies used. One frequency is said to refer to the tissue you want to treat. The other frequency refers to what is wrong with that tissue. For example, if you want to treat inflamed nerve root of the spine, you simply combine the frequency for the nerve cells with the frequency for either acute or chronic inflammation. If you are right in your diagnosis, it will usually work. Now, there are some caveats to this. The main one is how long you need to run a pair of frequencies. All pairs are somewhat time dependent, but some are much more so than others. The other is the fact that most problems are not as simple as just one thing wrong. So you have to take all this into account in designing a protocol. So you see, I have the tool to do the job, and the results speak for themselves. I've also found that just treating the mitochondria themselves improves the brain function. My acute Alzheimer's patient has other problems as well, and I am treating some of them with the remote FSM treatments. I will discuss remote treatments in another video. The important thing here is that I realized I could use frequencies instead of current to get the microcurrent effect in remote treatments where you have no current. It turns out that it makes remote treatments work much better, and in some cases work at all. So now I put a treatment for the mitochondria at the beginning of any remote treatment I do. And just doing that seems to be improving his brain function even without doing a dedicated protocol in person, which I did at first. So doing a remote treatment with my modifications seems to also be a treatment for, and probably a preventive treatment for, Alzheimer's. Now, my treatment is not a cure, just an effective treatment for some of the symptoms. It can even affect mood, since some brain chemicals affect mood. And of course, when your brain's working right, you're going to feel better anyway. You won't be as stressed. Acupuncture is also effective at treating pretty much any mood problem, such as the ones found in Alzheimer's. FSM and acupuncture work well together since they work by different mechanisms, so they work well to treat many kinds of these problems. I charge $30 for 3 remote treatments in a week. I found that is enough to tell it is having some effect. I have even treated some animals effectively with this approach. All I need from you is a picture of the patient's face, basically a selfie, and a good description of what is wrong. Since all of my remote treatments will help with Alzheimer's, you can pick another problem to deal with in the rest of the treatment protocol. such as the emotional problems, or you can find more information on my websites vackent.com and scientific-acupuncture.com. Or you can call or text me at 206-850-7999. Thanks for watching.